Welcome back to Mind Matters. Today we're talking about trauma. It can happen to anyone at any time, and it comes in a lot of different forms. So it's important for people to recognize the reality of what they've experienced and learn how to manage it in a healthy and effective way. So today we are joined by Kamala Glenn Taylor. She's a director of clinical services at Brentwood Hospital. Thank you for being here to help us talk about how to deal with this.
Thank you for having me.
Of course. So why is it so important to acknowledge it as early as possible, acknowledging trauma?
Because it's such a prevalent experience. If you think about, what's out there in terms of the research, what the research tells us that between 70 to 90% of us have experienced trauma in some way, shape, or form in our lives at least one time. COVID-19 is probably the most recent thing that we can think about globally. Was a traumatic event that we all lived through. So at least one or two events have occurred that's already impacted our lives in a meaningful way. So it becomes a really important topic, not just for those who have mental health disorders, but for people in general.
And a lot of people, when they think trauma, they think, big accident, like car accident or the loss of a loved one. But does it always have to be something that's monumental for it to be trauma?
Not at all. Trauma is a really subjective experience. You and I can go through the same event, but we're going to come out of it in two different ways because it has a lot to do with the way that I experience that event as well as the effects that I walk away from.
Right. And what are some ways that trauma can sort of manifest itself, either in the body or in the mind?
Well, people can experience, there's some of the normative things that come along with going through an event that is traumatic. Of course, there's the anxiety, there is the feeling of depression, there are the feelings of paranoia, having flashbacks. There's so many different kind of, not just mental but also physical symptoms that go along with that. Sleeplessness, extra fatigue that can come as the result of going through something that's been significant for us.
For sure. So we're talking about ways to deal with it. There's a thing called self-compassion. What is that and how do we practice it?
Well, one of the things to keep in mind is because trauma is such a prevalent experience and because everybody has their own experience of it, it's important for us to not judge ourselves or our experience in comparison to somebody else's. So because somebody has gone through something that is significantly, in your perception, a harder thing, doesn't mean that the thing that I've gone through is diminished because somebody else is going through something hard. I also have my own experience and my own way of walking away from that experience that's shaping how I look at the world, how I may have relationship with people, how I'm able to show up as a human being. And so it's important for me to be able to stop and pause and not judge what's happening with me, but really acknowledge that there's a wound that has occurred. And the best way to move forward from that wound is to acknowledge and then start the cleanup of that wound, if you will.
So talk about that cleanup. I mean, obviously trauma affects people differently, the process looks different, but what are some common ways to help deal with those wounds?
Well, piggybacking off what you said about self-compassion, start there. Start with that gentleness with yourself. Understand that you've been through something that's been particularly disturbing, particularly impressionable on you. And so knowing that I can be okay after a while is important to start with that. But of course, there are many other things that people employ in terms of, treating trauma. It's, those self-exploratory things, maybe journaling. Let me talk through this experience that I've had, put it down on paper, voice record it, or just to kind of get that, the sting of it away. There are people who take things a little bit further in terms of practices that they might incorporate into their daily life. They might do things like meditation. They may do things like physical exercises, yoga, those kinds of things. And those are things that you can do on your own. But of course, there are also the treatment level of care things where you're going into psychotherapy or you're doing specified trauma treatments like EMDR or which is eye movement desensitization reprocessing, which is a specific trauma treatment protocol for people who have been through really significant things. There are also other models of care out there. ACT is another one that comes to mind. ART rather, is another one that comes to mind. Accelerated resolution therapies, that's what that refers to. As well as, your trauma-focused cognitive behavioral therapy. There's several therapy models that are really successful in the treatment of trauma. So those are things that people can think about as well.
Great tips here. Thank you so much, Ms. Glenn Taylor, for coming in and letting our viewers know exactly what this is and how this really can affect anybody.
I'm glad I was able to be here and
Me too.
shed some light.
Absolutely. Thank you so much.